right, so welcome to Transforming Healthcare. We're going to look at Alteryx use cases for enhanced efficiency and insight. I'm going to start with just an introduction. Then we'll talk about some common data challenges in healthcare. We'll talk about Alteryx as a solution. And then we'll move into Alteryx in the healthcare industry, particularly how we can overcome those common data challenges. And then we will finish off with some use cases. You already learned a little bit about me from Yvonne's introduction. I was named an Alteryx Ace this year, and that is a tremendous honor that was bestowed on me from Alteryx. I am certified in all things Alteryx, the cloud products, the desktop products, server, all of the products. The only certification that I don't have yet is my expert certification, which I plan on trying for later this year. I've been working with the Alteryx platform for about 9 years now, and most of my experience is within the healthcare and finance domains. As you can see from the pictures, I am married to a wonderful man. I have a son in that brightly colored shirt, as well as a beautiful stepdaughter. And together we also have 4 dogs. Our 2 youngest labs are pictured here. I am also an avid Jeep and motorcycle enthusiast. And so you can see that picture of my Jeep when I was rock crawling out in Texas. Now, a little bit about Data Meaning. Data Meaning is an Alteryx premier partner. We are a boutique business intelligence consulting firm, and our mission is to drive world economic growth by enabling businesses to extract quantum value from one of the world's most valuable commodities, data. We deliver the end-to-end business intelligence expertise and can work with a system you already have in place. Our goal is to deliver the exact intelligence and insights that your organization needs to achieve high performance and outcomes. You can see some of our partners here: Amazon, Snowflake, Alteryx, Matillion, Cloudera, Microsoft, Elation, Informatica, and Tableau. All right, so enough about me and our company. Let's really get to the meat of our presentation. I want to start a little bit by talking about common data challenges within the healthcare industry. One of the most paramount concerns and challenges that we face in the healthcare industry is related to data privacy and security. We have to protect from unauthorized access to sensitive member and patient information. HIPAA compliance is necessary. There's also a challenge with insufficient data encryption and protection measures with a lot of software. Next, we move on to data quality and integration. Difficulty integrating data from various sources, hospitals, clinics, pharmacies. Often there are multiple systems with this data within your organization, whether you are a payer or a provider. And we have to make sure that all of those systems are compatible. And one of those issues that we have is we often have these different IT systems and they have different data formats, which really makes that integration difficult. Another issue that we face is with data standardization and consistency. Standardized formats ensure consistent data collection and facilitate seamless analysis across various healthcare systems. Some of the issues that you might face are duplicates in member or patient records, inconsistencies in coding practices across different departments or providers, discrepancies between policy records and actual coverage details, differences in units of measurement. This is a big one that hospitals often face, that maybe the hospital lab and independent labs that they might leverage use different measurements. We also struggle with missing or incomplete claims information. Partial member profiles or lacking contact details or medical history is often an issue. Then we get to our data structure issues. Patient records, medical images, genomic data, physician notes, all of these are just examples of the different types of data that need to be stored for analysis. Because data can be fully structured, semi-structured, and unstructured, they're often stored in different locations, which takes us back to that data integration issue. These disparate data sources present challenges when we need to use this data for analysis. Point 5 there, operational inefficiencies. All of these issues that I previously mentioned really do lead to operational inefficiencies. We have increased administrative costs from resolving the data discrepancies, operational inefficiencies due to manual data reconciliation processes, and impeded decision-making processes because of that unreliable data. And all of this can lead to that very last point, regulatory and compliance risks. Non-compliance with data retention policies, penalties or fines due to data breaches or mishandling of member or patient information, and challenges in meeting audit requirements due to data inaccuracies, gaps, or lack of integration are all major concerns. Each of these leads to data and analytics reporting challenges. Inability to perform accurate trend analysis due to inconsistencies, challenges in generating reliable reports for those regulatory compliance reporting, or even to make business decisions. Data silos also hinder comprehensive analytics. And so all of these issues combined really do plague the healthcare industry. And again, it doesn't matter if you're a healthcare payer or a provider. So now that we've talked a little bit about some of these common data challenges, I want to talk a little bit about Alteryx as a solution. One of the biggest things about Alteryx is that it makes analytics easy. Customers love how easy it is with the intuitive UI. There's also this low-code approach that really simplifies data engineering, preparation, analytics, machine learning, and insight generation. And it makes it easy for anyone to be able to tackle those tasks. The smart automation and augmentation across the platform really accelerates analytics steps. From wizards that help you build your first machine learning model to automating workflows and just distributing insights. And with hundreds of different ways to access data stores, cloud applications, RPA bots, and flat files built right into the platform, users no longer need multiple tools or even have to write SQL to get the data that they need. In addition to being easy, Alteryx covers everything. It provides a unified end-to-end analytics platform, enabling everyone in the business to participate in and accelerate the analytic lifecycle. From data access and prepping and blending to advanced analytics, machine learning, and business insights. Many of Alteryx's customers use Alteryx for this end-to-end analytics process. And as you can see, you can use Alteryx from ELT or ETL all the way through your outcomes. So in addition now to Alteryx being easy and covering everything, that brings us to my next point, that Alteryx is really for everyone. I previously worked for a healthcare payer for a number of years. I was there for 17 years total at this health insurance company. And while we started with Alteryx in operations in our analytics team, by the time I left with just 5 years of Alteryx under our belt, we had everyone from HR, finance, even legal leveraging Alteryx. So Alteryx is that easy that it can be used by everyone. I always say, if you use Excel, you can use Alteryx. So the next few slides are just about some of the Alteryx products. Alteryx Designer Desktop is the flagship product that Alteryx built. It is the most mature offering and represents the foundation of the platform. Designer is the leading solution for data prep, blending, and analytics. Everything is drag and drop, and it speeds up every step of the analytic process. But what truly makes Alteryx Designer unique is the combination of its ease of use and intuitiveness, along with its comprehensiveness, flexibility, and power, allowing users to take analytic challenges, whatever they may be. Designer ships with more than 70 native connectors, which really simplifies access, accelerating ROIs. It also has over 300 tools built into Designer Desktop that can be shaped into an analytics automation workflow. You build once and repeat never with Alteryx Designer. Now, as the world is moving to more cloud-based products, Alteryx is no exception. With Designer Cloud, analysts of all skill levels can perform self-service analytics and easily transform data, ensure data quality, and automate data pipelines at scale using the no-code, low-code interface. It has a very similar feel to Designer Desktop, but some of the enhancements that you see from the cloud product is that it does work better with the cloud data sources that a lot of organizations are moving towards. Having some of those cloud data sources allows for data of all structures to be stored in one location and then accessed using Designer Cloud. You can see your data after every step in your analytics process. This also leverages push-down processing, which can allow you to really leverage that limitless scalability of your cloud data warehouse, so you get your insights faster. All right, so Alteryx also has the server available. And with the server, any automation or data search can be given to anyone you want within your organization. So one person can build the automation in Designer and then share that on the server to be used by all of the coworkers within your organization that you want to share it with. And above all, it is secure and governable. Sorry, that's a really hard word to say. Imagine multiplying your best person across an entire team with a repeatable, scalable, governed, and easy to use automation. And that's really where Server comes in. This Alteryx server accelerates your analytics maturity by providing robust controls for remote employees creating workflows. It is high performance that removes local and manual dependencies for the end users. Easy and advanced scheduling to automate your workflows for continuous answers. And secure sharing and collaboration for data and insights. Moving back to the cloud, we also have the Alteryx machine learning platform. So while we can do machine learning in Designer Desktop, one of Alteryx's newest offerings is the machine learning application in the cloud. It has this great education mode that walks you step by step through creating a machine learning pipeline. You can actually learn how to do machine learning as an everyday ordinary person and not a data scientist. And I say this often, I admire data scientists. I am not one. So if I can do the work to even partially get a machine learning model ready to pass to a data scientist so that they can do the tweaking to make it better, that saves time for everyone involved in that process. Along with the machine learning platform in the cloud, there's also Auto Insights. And I'll be showing Auto Insights in one of my use cases later on in this presentation. Auto Insights allows you to upload data or pull data from the cloud and leverage machine learning behind Auto Insights to just gather insights from that data. There's no work that you have to do besides putting in the data. You, of course, can tweak the reports and the outputs that come from this tool, but it's really a quick win when you need to deliver insights from a data set. It also has amazing storytelling. So not only do you have your scalable insights that rival what you can do as just an everyday human, it's like having this virtual data analyst on call 24/7. All right, so now that we've talked a little bit about some of these Alteryx products, let's get back to our healthcare industry. After all, that's really what you guys came here for. We mentioned those data challenges before. And now let's talk about how we can overcome these data challenges leveraging Alteryx. First, let's talk about data privacy and security. Alteryx provides a desktop analytics and server environment that meet the thresholds for Federal Information Processing Standards, which is also known as FIPS. The compatibility as established by the National Institute of Standards and Technology. Also, in accordance with the Federal Information Security Management Act and as approved by the Secretary of Commerce. So as you can see, this software really was designed to meet all of the federal standards. In addition, the ISO 27001 certified Alteryx Analytics cloud platform enhances security. It isolates permissions and manages risk by separating application control planes and data planes. The control plane orchestrates the workloads, provides the user interface, and manages the application usage data. The data plane gives customers self-service access to their data to run the analytic workloads. To further enhance security, customers can also keep the data plane in their own cloud environment using private data handling. So whether you are using a desktop version of Alteryx or a cloud version, all of the necessary security protocols are available. And even Alteryx takes it that step further with the private data handling. Alteryx also maintains a comprehensive information security program designed to protect the confidentiality, integrity, and availability of customer and user data in accordance with all applicable industry standards. So in addition to those standards that are set forth in the United States by the federal government, the security program includes measures intended to meet or exceed protection requirements for personal data, including those outlined by the General Data Protection Regulation, which is a component of the EU privacy law, and also the California Consumer Privacy Act. So not only does this meet federal standards in the United States, it meets the standards in the European Union, as well as the standards that are set around the world. Our next data issue that we face in the healthcare industry was related to data quality and integration. Alteryx includes tools that allow you to analyze the structure and quality of the data, identifying issues like missing values, duplicates, and inconsistencies. The data profiling tool helps users understand the characteristics of the data, such as your distribution, frequency, and outliers in your data. There's also data profiling that's available in our results window with every run. Then we also have data cleansing, and Alteryx provides functions for standardizing, cleaning, and correcting the data. It can automatically handle issues like typos, case formatting, and even trimming off extra white space. The data cleansing tool is specifically designed for tasks like removing nulls, converting data types, and handling these irregularities. When it comes to integration, Alteryx allows you to integrate your data from various sources, including databases, cloud services, spreadsheets, and APIs. The platform supports a wide range of connectors and can blend data from disparate data systems into one unified data set. I remember this was a huge issue for us at my previous company before getting Alteryx. We often had different plans that were on different systems according to the type of plan it was. Our state health plan used a system that was provided by the state. Our federal health plan required a different database structure. Then we had our claims processing system for all of the rest of our policies for that end-to-end enrollment through processing. And when you think about merging all of those disparate data sources, it can really be a hassle if you're touching these different systems. And before Alteryx, we often had to do a lot of merging of the data using Excel. Thankfully, that is no longer the case. Alteryx can also perform across database joins. So you're joining across those different databases, even when they use different technologies like SQL Server and Oracle, facilitating that seamless integration. When it comes to data standardization and consistency, some of the ways that Alteryx can help us here is with data validation. We have tools in Alteryx where we can validate data against business rules or for specific criteria. This helps in identifying and correcting errors before the data can be used in analysis. Alteryx also can help with error reporting. It can generate reports on data quality issues, providing users with those actionable insights to improve the data. We can also leverage the repeatability of Alteryx. This platform allows users to create automated, repeatable workflows for data quality and integration. And once the workflow is created, it can be run on a schedule, which ensures that the data is consistently clean and integrated without any manual intervention. We can also custom standardize the logic. The formula tool enables users to create custom expressions to standardize data. For example, you could use conditional logic to format dates, concatenate fields, or apply specific transformations to ensure data consistency. There are also many tools within Alteryx where you can save your settings or save your formulas for reuse. It also helps with standardizing inconsistent entries related to the fuzzy matching tool. So fuzzy matching helps standardize data by identifying and correcting variations in similar but non-identical text entries. This is particularly useful for cleaning up inconsistent names, addresses, or product descriptions. When I talk about fuzzy matching, I have to talk about one of the issues that we commonly see in the healthcare industry is that patients will give their common name at their doctor's office, but their insurance is often with their legal name. So being able to leverage fuzzy matching to match individuals to their policies when we receive a different name on correspondence or different information than what we have in our system, you can leverage the fuzzy matching to make more of the matches than you can with just a standard join on the data. In addition to this, we can also just automate any kind of standardization tasks you might have. Users can create macros to automate standardization processes, ensuring that the data is consistently formatted every time it's processed. And macros can be shared with others in the organization to ensure that everyone is leveraging those same standards. One of my favorite use cases in regards to leveraging a macro for standardization was actually related to a date format we had in one of our original claims processing systems. It was a legacy system, and the dates were just wonky. The date was actually a 3-digit year, 2-digit month, and 2-digit day. So today's date would have been written in this database as 2240814. As you can see, that date can present some challenges when you're trying to work with your data. And so I built a macro that was then leveraged by everyone in my company that used Alteryx. And that macro simply converted this wonky date format into a usable date. All right. So the last issue that we're talking about here is with our data structure issues. Within Alteryx, we can handle unstructured, semi-structured, and fully structured data. And there's a whole bunch of transformation tools that can also be used to restructure the data as needed within a workflow. Now, all of these issues regarding data in the healthcare industry that I've gone through are all solved with Alteryx. And if we handle our data security, our structural issues, being able to blend the multiple data sources and types of data, being able to consistently clean our data and format it correctly, all of those lead to better regulatory reporting, better reporting in general. And then we're less likely to face any sort of fines due to those regulatory reporting. It takes a lot of the human errors out by being able to automate your processes using Alteryx. All right. So now that we've worked through our data issues in the healthcare industry, we've talked a bit about the Alteryx products. We've talked about how Alteryx can help with these issues that we face in the healthcare industry with data. Let's start talking about use cases. All right. So you'll see here, I have this really big slide with healthcare use cases. And these are actual use cases that you can find more details about through the Alteryx website. They have a lot of customer stories on there where you can see various use cases. And as you can see, these use cases aren't refined just to the clinical data or analytics teams within the organizations. We have use cases for operations, asset, and supply chain management. We can look at KPIs and automate workflows to feed those KPIs into a Tableau dashboard or a Power BI dashboard, letting Alteryx do the heavy lifting. We can use Alteryx to optimize things like operating room efficiencies. Alteryx has also been integral for some organizations in managing the Epic system. Particularly, there have been use cases that are showing how they're able to optimize the emergency department management in the Epic system. We can also get into things like supply chain optimization and forecasting for medical supplies. When it comes to strategy and regulatory compliance, we can look at healthcare facilities by locations and attributes. Alteryx can handle spatial data, so you could actually plot facilities near you or competitors by location on a map as part of a report or dashboard. You can do a bunch of different dashboards we have listed here: service line dashboard, utilization dashboard. But we can also leverage Alteryx to look at our physician specialties and affiliations and making sure all of that is up to date. With the physician specialties and affiliations, this is key on both the payer and the provider side, particularly in the larger organizations on the provider side, making sure that everybody is up to date on all of their credits for continuing education, making sure all the paperwork is done to have physicians credentialed properly, also credentialed or with the various insurance companies that you may do. And you can automate all of that using Alteryx. Then we get into HR, and you can help manage schedules for staffing. You can also use predictive analytics within Alteryx to predict clinical staffing, predict turnover, whether it's nurse turnover or just turnover of your employees or staff in general. You can also leverage Alteryx to analyze and predict candidates if they would be good employees based on their resumes. We can predict employee retention and analyze and predict, sorry, that one's on there twice. My apologies, our candidate resumes. Alteryx is also leveraged in the finance and revenue management. From revenue cycle reporting and analysis to feeding everything into dashboards with financial metrics and KPIs. Also, a big thing is account receivable reporting. At the previous company that I worked for, when COVID hit, one of the things that we were concerned about is, are people going to be able to afford to pay their insurance premiums? That was a big thing when the world shut down for COVID. And what we realized is with all of those various lines of businesses that we dealt with, from state, federal, our healthcare reform policies that were purchased through the marketplace, policies purchased through us, we did not have one unified report with our account receivable information. So all of these bills that we send out to groups and individuals, we didn't have any one thing that would reconcile our bills with what we were receiving across all of our systems. We were able to leverage Alteryx to really quickly pull together an account receivable report. It took us 2 weeks and a lot of hours because we were dealing with COVID. We needed to work rapidly, but we were able to pull in that data from all of these disparate systems and then output this data to a Tableau dashboard that could be leveraged by our board of directors and everyone in the C-suite to really make decisions, but also have those conversations with the federal government about the COVID impacts. All right, and that brings us to our last category in the healthcare use cases here, clinical and population health management. Once again, you can utilize your data in dashboards with population health management dashboards, patient tracker metrics, predictive analytics for patient care outcomes. In fact, one of the workflows that I'm going to show in just a few moments is doing just that. It's leveraging data to predict whether the patient would be possibly diagnosed with diabetes. Whether you are a healthcare payer or a provider, it is integral in order for us to keep healthcare costs manageable for everyone that we really work towards better patient care outcomes. And so being able to predict things and be proactive is really what we're seeing in the healthcare space right now. We want to be more proactive. We really want to improve efficiency, particularly as we're going towards a more results-based paying system on the provider side. Because of that, with providers, you have to care more about your patient outcomes. Also, on that payer side, it is integral that we really do look at those patient outcomes and really focus on being proactive, because the more insurance claims people have, the higher the costs, for the policies in general. One of the things that we've also looked at, and this was a personal use case that I've worked on in the past, was really doing predictive analytics on patients with higher risk of readmission. So I looked at that from the payer side, but if you're a hospital system, that's also really important to you. So understanding when a patient comes into the ER or a patient is admitted, understanding what really drives them to be readmitted within 48 hours or 72 hours. What are those risks? What are those little data elements that you can notice through the first hospitalization if that patient is going to come back? Same thing goes with ER visits. Readmission to the ER is an ongoing issue. And if you have the data to tell you what to look for, you can help with those readmission rates. All right, so now that we've kind of talked through some of these use cases, let me quickly go to Alteryx and show you some of these use cases. So this first use case is predicting a diabetes diagnosis based on specific medical tests. I am not a data scientist. I have said that before. So I don't naturally come to these R tools and try to do these models by myself. I know how to use them, but it just doesn't come naturally to me because I haven't been trained as a data scientist. But with the machine learning tools that are available through Intelligence Suite, I am able to quickly use this assisted modeling tool to be able to build this entire machine learning pipeline. So I just started with a data set, looking at the number of pregnancies, the glucose levels, blood pressure, skin thickness, insulin, BMI, the diabetes pedigree function, and their age to try to predict their outcome if they were going to be diabetic or not. With a sampling tool, I was able to quickly split my data set into two different data sets, one that I could use to train the model, and the other I could use as an evaluation in my model. So once it builds this entire pipeline for me, I can come to the end and I can see the likelihood of my predicted outcomes. Even more than that, if I wanted to take this entire pipeline, I can go back into my assisted modeling tool and I can export this entire model that you're seeing on your screen, export all of this to a Python tool that I can leverage going forward. This entire pipeline, I spent more time putting together the data set than it did to build this pipeline. I built a machine learning model in 30 minutes to predict diabetes. All right. So this is part of Intelligence Suite. And I just wanted to say one of the other big things from Intelligence Suite that I love is the PDF to text tool. If you have one of those organizations where if you get anything by paper, they scan it in, leveraging the image to text or PDF to text tools really helps you eliminate the need for manual entry of those documents that have been scanned. You can pull them into Alteryx, convert them into data, and feed them right into your databases. I also wanted to show a claims fraud app that I built. This is an analytic app, and as you can see, the interface is quite in depth. And I've actually built a number of analytic apps at my previous organization. The great thing about analytic apps is a developer can leverage them and then put them up in the Alteryx gallery. They look so much better in the Alteryx gallery. And the cool thing about the gallery is it can be accessed by people that don't have access to Alteryx. So in building analytic apps, we were actually able to remove 80% of the ad hoc requests that were coming to our operation analytic team at my previous organization. So let me say that again. Using analytic apps, we removed 80% of the ad hoc requests. That is huge. And that frees up a lot of your analysts' times to no longer be order takers, but really focus on the more advanced analytics. Just to show you what this looks like really quickly on our server, it does look a lot better. Let me pull that up here. When a user comes out to the server in order to run this, they would just click run. I do get this additional pop-up, but that is something that is organizationally dependent. Oh, so it did expire on me. Bear with me for just a moment and let me just re-log in here. So that is one of those security protocols that you can implement is a timeout feature on your server in terms of people being logged in. All right, so coming back out, click my run buttons. And this is the analytic app that they see. I built this app to be able to pull claims data when fraud is suspected. Often, if fraud is suspected, particularly when we're dealing with a healthcare payer or even a provider in a big organization like a hospital system, when fraud is suspected, that call comes into customer service. Then customer service has to send a request to analytics for the data. Analytics then sends that data back. Then they have to send it to fraud for investigation. Building an app like this removed analytics from the equation altogether. Whoever would get that call regarding fraud, whether it came through a fraud hotline or customer service or just somebody at a desk, the individual can come out to the Alteryx server, enter the necessary information, and run the workflow. All right, the last use case that I wanted to show you is leveraging Alteryx's cloud product of Auto Insights. Auto Insights, you can see we can set up in 10 seconds, 15 seconds, 30 seconds. We have all of these various missions that we can deliver. If I click on this executive summary, I am leveraging call center data in here. And this data can either come from a cloud data source or can be uploaded to Auto Insights. If I wanted to see how my call center was performing and what was causing issues in my call center, all I have to do is create a mission and the magic happens with Auto Insights. We can see that there was a big decrease in calls out. We can see statistics on our averages. We can see our calls in. We can see average activity time. So we can leverage these insights to make modifications on the fly to call centers. And even more than that is we can output these as various reports, PowerPoints, emails, dashboards. We can leverage these insights very quickly. All right, so I just wanted to show you these few use cases in addition to that giant list of use cases. I do want to open it up. If anyone has any questions, please let me know your questions. You can drop them in the Q&A box or drop them in the chat. Any questions?
Okay. First of all, thank you so much, Sarah, for your amazing presentation today. So I want to know too, do you guys have any question for Sarah about this? This is the time for your questions. Please feel free to write on the chat in the Q&A section, please. While we get some questions, Sarah, if you're okay with that, I have two for you.
Sure.
Okay, thanks. First, how do you secure the app on the server so only those that need to use it can access it?
Yeah, that's a great question. The way I organize my apps is actually in collections. In a collection, you can dictate who can have access to it. When I built the series of apps that eliminated that 80% of the ad hoc requests, I actually created collections based on the data access that each team was able to have. So they could only see the data that they needed to see and nothing more. I could also dictate my users by leveraging Active Directory or by just manually controlling my users in my collections.
Okay. That's awesome. Thanks so much. The second question for you is, did you say while you were presenting that no designer license is needed for people within the organization to run a workflow on the server? How's that?
That is correct. So on the server, you have viewers that can come out without an Alteryx license and run anything that's in the public space on your Alteryx server or anything in a collection that you give them access to. That is a great thing because you don't have to spend the extra money for everyone in your organization to leverage Alteryx just to get the insights from the platform.
That's great. That's great. We have a question from Antonio. He say, are there any articles related to these use cases written by data meeting?
That's a great question, Antonio. We do have a bunch of use cases that we have put on our various social media channels. We also do have some information on our website. In terms of specific articles regarding these use cases, I haven't written anything yet, but that is a great idea. So be on the lookout for some of these use cases to be written up and shared on our LinkedIn page. I will also make sure I share them on my LinkedIn page. And so if you're interested in following me on LinkedIn, you can scan that QR code. We also have a email address, info@datameaning.com. If you have any follow-up questions that I did not answer, you can email us or email me directly, and we're happy to assist you.
Sure. We can work on that together, Sarah. No worries.
That sounds great, Yvonne.
Sure. Excellent. Any additional question for Sarah, or that's it for now? So, okay, I think that all the questions we have now. Thank you, Sarah. Thank you, everybody, again. We hope you find this content useful for you. Thank you, Sarah, for your time. This has been so great, and I'm eager to see how the healthcare industry is beginning to transform it with Alteryx. I'm pretty sure of that. We'll be sharing this recording later this week, so no worries, everybody. Share with your teams, no worries. And thank you, everyone, for your time, and have a great rest of your week. Thanks all. Thank you.
Thank you. Bye, everybody.
Bye-bye. Bye.